The continuing popularity of eating out has Americans spending almost as much on meals at commercial food service establishments as they do on meals they prepare at home. Whether at home or out on the town, it is important to be aware of and avoid food poisoning. To avoid it, we must first understand what it is. Food poisoning is an illness that results when you eat foods contaminated by harmful organisms, such as bacteria, parasites, or viruses. There are many ways food can become contaminated. One way is during food processing. It is normal for the intestines of healthy animals that we use for food to contain bacteria. If these organisms come in contact with the poultry or meat during processing, they can contaminate the food. Fruits and vegetables can be contaminated during the growing process. Food can also be contaminated during the handling process. Infected or sick people handling food can contaminate it with their germs. Or, if the food comes in contact with another contaminated product, it too can become contaminated. Finally, the environment in which the food grows can contaminate it. Dirt, dust, and water commonly contain many harmful organisms. Environmental conditions make it easier for these types of organisms to make their way into our food. One of the most common types of food poisoning is salmonellosis, known as salmonella. Salmonella bacteria are frequently found in the intestines of birds, reptiles, and mammals. Handling the waste from infected animals or consuming undercooked meat juice from raw meats or other contaminated foods can spread the bacteria to humans. Symptoms of salmonella develop 12 to 72 hours after infection, and the illness usually lasts 4 to 7 days. While most people recover without treatment, for those in poor health or with weakened immune systems, salmonella can be very serious and potentially life-threatening disease. The most common symptom of food poisoning is diarrhea. Other symptoms include nausea, vomiting, and stomach cramps. The time it takes for the symptoms to appear, their severity, and their duration depends on the infecting organism as well as one's overall health. Diagnosing food poisoning can be difficult because most of the time it is mild and passes within a few days. Many people do not even go to a physician for a diagnosis. Oftentimes, it is safe to assume that your illness is due to food poisoning if others who ate the same foods you did also become ill. Most of the time, diarrhea and other symptoms of poisoning go away in 2 to 3 days, and you do not need treatment. If you are experiencing symptoms, make sure you are drinking fluids to avoid dehydration. Once you feel better, begin eating mild, low-fat foods such as bananas, rice, applesauce, or dry toast. This is called the brat diet. If you do become dehydrated, you may need to seek medical treatment. While antibiotics and medications are usually not used for food poisoning treatment, in rare cases, immediate and intensive medical attention may be needed. The key to avoiding food poisoning is prevention. To prevent food poisoning, be careful when preparing and storing food. Wash your hands and all work surfaces while preparing food. Cook foods to safe temperatures. Refrigerate foods promptly and at appropriate temperatures. And be especially careful when heating or cooking foods that can easily go bad, such as meats, poultry, eggs, fish, shellfish, milk, and other dairy products. Following these simple steps will help you avoid food poisoning and keep you healthy and enjoying your dining experiences.